The IV dressing is the bandage that protects the point of entrance intravenous catheter. To be effective, this bandage has to be changed using sterile techniques. If a microorganism reaches this entry site, it can also enter the vein and cause an infection in the bloodstream called septicemia. Knowing this explains what's important to perform appropriate IV dressing change technique. And this project is a great opportunity to learn. How many of you know how to properly change the IV dressing? My name is Jose Pina. I have been working as a registered nurse doing infusion at home for almost 10 years. And today I would like to show you how to perform the procedure following an aseptic technique. First of all, let me demonstrate you step by step the entire process to change the IV dressing. The first and most important step is to wash your hand and use hand sanitizer. After you wash your hand, the next step is to select the supply to use. The supplies are a sterile glove, surgical mask, alcohol pad, tape, sterile line, alcohol swab, antiseptic swab, skin protectant, biopad, securement device, Tegaderm, microclave, and cap. Now that you have selected the supply, it's time to begin the procedure to change the dressing. First of all, you have to put the surgical mask on and give one for the patient too. Okay, now it's time to put your glass on. Okay, and using alcohol swab, remove the old dressing. Also, you have to remove the securement device, and use a small piece of tape to prevent the PICC line to pull out from the vein. Remove the glove and take a new one. Okay, now using the alcohol swab, clean the area around the gum in circular motion. You have to allow the skin to dry itself, and after that, use the skin protector. Okay, now remove the glove again. And use a new one. Okay, the skin is already dry, so you have to use the biopad. The biopad has the function to protect the insertion site of the PICC line, and also allow to prevent infection. After that, use the securement device to prevent the PICC line to pull out from the vein. Cover with the Tegaderm. Also, you have to change the microclave. Remove the old one. Clean with alcohol pad. And then put the new one. And finally, put the cap. Don't forget to put the date and the time you did the dressing. In this speech, I explain you step by step the entire process to perform the IV dressing, beginning with washing your hand, then the selection of the supply, and finally the procedure that I described you. Now that you know how to perform the procedure of IV dressing, keep in mind that doing this procedure properly can help to protect the point of catheter insertion and thus prevent infection. Finally, it is essential to remember that during all procedures, the adequate use of aseptic technique is a key element to prevent cross-infection and also to protect the integrity of the patient.